So now we begin with the end of life care lecture. I highly recommend before you start this PowerPoint and this lecture that you go back and you watch the Being Mortal documentary on PBS. It's 54 minutes, but if you have limited experience with hospice or end of life type situations, it gives you a lot to pull from and apply what you're getting ready to learn. So take the time to do that before you start this lecture. A term you're going to need to know for your test and just in general is palliative care. And this is care that's given to people who have serious life-threatening diseases. So cancer, AIDS, congestive heart failure, things like that. This is for the very ill or the dying. The purpose of or goals of palliative care is to control symptoms, reduce suffering, prevent side effects, maintain quality of life, and to emphasize that holistic approach, which it's looking at the person as a whole, their spiritual needs, their social needs, their physical needs. All of those things are very important. Pain relief is very important. When we talk about control of symptoms, pain relief, but if they're, let's say, have a condition that causes them to have lots of stomach problems, you can go in and do maybe a procedure that would relieve some of those stomach problems. So it's about controlling, not curing. And once again, we just talked about that. Terminal illness. This is when a disease or condition is eventually going to cause death. Hospice care is usually the next step for that. With hospice care, it's usually 6 months or less to live, and it's ordered by a doctor. Now, doctors don't know everything, so they make their best educated guess. And if you outlive the 6-month timeline, that doesn't mean you get kicked out of hospice. There are people that are on there for a longer period of time that live longer than what the doctors projected. And sometimes people are expected to live longer and they don't live very long at all. It does use the holistic approach, and it also focuses on the family. So yes, the resident is very important, but they also take care of the family's needs, helping them prepare, following up with them after the passing of the resident. Hospice is a really good approach. Some of the goals of hospice is about compassionate care. They do pain and symptom management. They help with the psychosocial needs. Like I said, they do help with the family as far as like financial counseling and legal assistance if needed. They're on call 24 hours a day. So if it's the middle of the night and the person needs some assistance, the family can call and they can be there. Hospice can take place in the home. It can take place in the hospital. It can take place in a long-term care type facility. It just really depends on what the wants or the needs are. So can you tell me, why is it important that residents who are dying have control over their lives for as long as they're able? When you think about that, I feel like the answer has to do with control. When they can't control anything else, they can't control the outcome. They can't control what's happening, the fact that they're dying. Anything they can control is very important. So letting them be able to make those decisions is really important. Grief, this is a deeply emotional process that is a response to loss. When we talk about Kubler-Ross's stages of grief, this is something that you're going to want to be familiar with. You will see questions about this on the quiz, so you'll want to be able to apply this information. So the 5 stages of grief are denial, anger, bargaining, depression, and acceptance. And so this is meant for the person who is dying, but they have also adapted it for anybody who's going through grief. I did attach a video about the 5 stages, so take a minute to look at that. But the main thing is you need to know how to apply this to certain questions that you'll have on the quiz. Not everybody goes through each of those stages in order. Sometimes they may stay longer in one stage or skip one stage completely or be in two stages at the same time or toggle back and forth. So it's not a textbook thing that everybody goes through it the same way. It's very individualized experience for each person. When a person's dying, we want to respect their legal rights. So they have the right to have visitors. Oftentimes visitors are restricted in certain settings, but as a person's dying, that is eased up quite a bit. We want to be respectful, understanding that everybody grieves differently. So sometimes it looks like they're having a party in there. That may just be their way of dealing with grief. Sometimes you got a little Jerry Springer going on and people are fighting because the ugly comes out in people when loved ones are dying. And usually if there's an inheritance or money involved, people don't always act their best. So just be aware, as long as they're not causing distress to the person who's dying or becoming a safety issue for other visitors or other residents, we need to give them some grace during this period. The right to privacy is really important. When you go in and you are caring for a resident, changing their bed, cleaning them up, and there's 4 or 5 people in the room, please ask them to leave or pull the curtain. It's really important to still maintain dignity and respect for the resident, even when they are in their last hours. They have a right to be free from pain. So they may get to a place where they can't speak any longer, and we need to be able to watch for those signs and symptoms that they need pain relief. We need to be aware of that. We should not let them lay there suffering because they cannot verbally ask for pain relief. The right to be honest, to honest and accurate information. Remember what your scope of practice is. You can't be going around and telling patients and loved ones their diagnosis, and that's not within your scope, but they do have the right to know what's going on in their lives. And the right to refuse treatment. So have you ever cared for someone who did not want more treatment, and how did that make you feel? These are questions that you're going to find, and depending on the age of the person, that may bother you more if they're a younger person and they decide they don't want any more chemo or something along that line. But whether we agree or disagree, we have to respect them and we have to honor them in those difficult times.